Welcome to the latest installment in our webinar series with the Oregon Physicians for Social Responsibility and the Oregon Justice Resource Center. My name is Bhavan Singh. I am the Executive Director of the Oregon Justice Resource Center. And today we're going to be talking about some work that we've been doing as organizations together and with members of our legislature around compassionate release. And this is an area that's been of, I think, a lot of interest for both of our organizations over the past year. I think over this past year, what has been revealed to us is that through the COVID pandemic, that as Oregonians and in Oregon, and as it relates to those who are in custody in our prisons, that there are a lot of complex issues that we have to grapple with. And one of them has to deal with those individuals in custody that have medical issues that may not warrant their continued incarceration. So how can we begin to look at our policies that exist, and how can we look at where and understand if they're working, and where they're not working, begin to have a constructive dialogue about how we can forward reforms that catch up to our modern understanding of science, our societal values, and really ensure that those people who don't need to be incarcerated for these reasons are no longer in custody. And we'll get into more details about that and talk more about like what this all means and what compassionate release means. But just really excited to be here and working alongside OPSR and the legislators, Representative Reynolds and Senator Dembro. So what I'm going to ask first is just for folks to do a quick introduction so people can know who's here and who's going to be participating. And then I will help moderate the conversation as we move through our webinar today. And hopefully this will be informative and instructive and give people some energy towards helping engage on this issue and understand actually how to engage on this issue. So I will start with Representative Reynolds, if you would kindly introduce yourself.
Hi, good afternoon. I'm really happy to be here with two organizations who I really admire, Physicians for Social Responsibility and the Oregon Justice Resource Center, and all the great people, of course, associated with that. That's what the organizations are. My name is Lisa Reynolds. I'm a state representative for Oregon House District 36, which covers much of Portland's west side. So it includes downtown PSU, OHSU, down to kind of Multnomah Village area. And I'm new. I just was sworn in January, so I'm learning a lot. I've known about, of course, the work of both these organizations for a long time and got to know Bhavan a bit during as I was a candidate, and just really pleased to be able to advance some important work. I should mention, I haven't mentioned this yet, I am a physician. I'm a pediatrician, so a little less well-versed in some of the adult medicine issues that come up, but having been on the front line of the COVID pandemic, both as a practitioner and now as a elected official, I certainly understand how the pandemic on so many levels has laid bare some of the underlying problems that maybe we probably should have been paying more attention to. And I think the medical needs of adults in custody is just one of those. So thank you so much. I'm happy to be here.
Thank you. And we're very excited to be working with you. And I think also, I think one of the really important things is that we've learned is, having these conversations and having the right people lead them. And I think having a physician that's able to help us navigate, these complex medical conversations is really important. And having OPSR involved in this conversation for us has been really important as well. Senator Dembro.
Yeah, hi, thanks. I'm Michael Dembro, and I represent much of Northeast and Southeast Portland in the Oregon Senate. I share Rep. Reynolds' admiration for both organizations. I've worked closely with both PSR, wearing my environmental justice hat, and OJRC on a number of issues related to our adults in custody. I've done a lot of, I've been on the Judiciary Committee in the Senate for a while and have been doing a lot of work on reentry for adults in custody who are released, and making sure that barriers to a successful reentry are removed. And more recently, I've been doing a lot of work on education and training programs for adults in custody. Have had a work group going for a few years now on prison education. And one of the beneficiaries of doing that work is it has brought me inside our facilities. A lot of that has been due to the work of OJRC, setting up tours and interactions with the adults in custody. So I'm really proud that our work groups, first the reentry, well, maybe that wasn't true. The reentry task force had formerly incarcerated people on it, but the prison education work group does have people who are formerly incarcerated as well as people who are currently incarcerated, and it's a great contribution. Anyway, I look forward to talking about this bill in particular, this work on having to do with early release.
Thank you, Senator Dembro. And yeah, we're excited to have you. It's always been great to work with you in the past, and your deep commitment to these issues related to criminal justice reform, and really helping to ensure the quality of life and opportunities for rehabilitation and sort of pro-social programming within the prison. So this is just yet another example, I think, in your portfolio, but it seemed like an obvious sort of partnership to reach out to you on this issue. Next, I'll have members of the Oregon Physicians for Social Responsibility introduce themselves. So I'll start with Theodora.
Unmute. Oh, there it is. Okay. Hi, I'm Theodora Songas. I'm an environmental health scientist and an epidemiologist, and I've worked in environmental public health for many years at the federal and state level in public health agencies, and held teaching positions at 3 universities in environmental science. And I'm a member of Oregon Physicians for Social Responsibility, and I'm very happy to be here. Thank you.
Thank you. And I'll have next Anne.
Yes, hi, I'm Ann Turner. I'm a retired physician in adult medicine. I worked most of my career in community health at Virginia Garcia Memorial Health Center. And I'm a member of Oregon PSR, the Healthy Climate Action team, where we definitely are concerned about environmental justice. And it's become clear how the intersectionality between environmental justice, racial justice, and criminal justice, they all have this incredible intersectionality that is really important to address. And I'm happy to be here, and thank you.
And next I'll have Catherine.
Oh, hi. I'm here too. I'm also a retired physician assistant and worked for most of my career at Virginia Garcia. And I'm really happy to be here and to be part of this organization, the OPSR, as well as to be working with the Oregon Justice Center. And I think this will be a really interesting conversation that we have today. Thank you.
Great. And last from OPSR, Yuvia.
Yeah, hello everybody. My name is Yuvia Morello. I'm the Energy Justice Organizer at Oregon Physicians for Social Responsibility. I've also personally been impacted by mass incarceration for much of my life and my son's entire life. And I just wanted to share, so Oregon PSR got involved in this work out of concern of the COVID outbreaks in Oregon state prisons. And we are really happy to be here and continue to be here and share this space with Oregon Justice Resource Center as a community partner. And through all this work, we've now come up with a statement about mass incarceration and how it intersects with public health. So I just wanted to share that really quickly. And it's also available on our website. Mass incarceration is a major public health issue in the United States. With over 2 million people currently incarcerated, the US leads the world in incarceration rates. The negative health impacts created by mass incarceration are present not only in prisons, but also the communities that prisons are located in and the communities where adults in custody come from, which are disproportionately low income and communities of color. So I just wanted to share that, and I also share my gratitude with everyone else for our representatives and senators being here with us today, and also working on these important issues that we'll dive into further.
Yeah, and I was just going to wait to hold my comments around OPSR, and what a wonderful opportunity it's been, and to be able to work with OPSR over these past several months. We have standing meetings each week, and quite honestly, it's one of the meetings I look forward to the most each week, because, you know, I think for us, sort of reorienting mass incarceration and criminal justice reform conversations through a public health lens is something that is, I think, long overdue. And being able to learn from the members of OPSR each week about how to think about these issues and dig deeper and deeper has been, I think, a lot of value for our organization, and I think has really allowed to put a lot of energy behind, you know, this conversation around compassionate release and other health-related issues as it relates to mass incarceration. So we're just really grateful to be able to work with, you know, Yuvia, Anne, Catherine, and Theodora each week, and other members of PSR. So, you know, thank you, and yeah, grateful to be able to have this conversation today. And so, lastly, is Zach Winston. If you just want to introduce yourself.
Yeah, so I'm Zach Winston. I'm the policy director for Oregon Justice Resource Center. This is my first session with OJRC. I'm formerly incarcerated. I'm also a former defense attorney. And thank you to everyone for being here. And also Senator Dembro and Representative Reynolds, to you guys for being here, but also your staff on all the help they've provided on these bills. It would be impossible without the work they've been doing. So appreciate it.
All right, so now that we've gone through the introductions and ready to dig in, I think the first question, I kind of set, you know, why this compassionate release is important. And I think what was really revealed to us during the COVID pandemic is there's just a limited amount of mechanisms to be able to review release opportunities for release for people who no longer need to be in custody. And none of these mechanisms guarantee release or automatically let people out of prison. But in Oregon, what I think was really highlighted is that there's very few mechanisms that even provide the opportunity to have that conversation of whether or not individuals should still be incarcerated. And if there's no longer that need, is the community a better place? And I think one of the areas that we see this most highlighted is those individuals that have medical issues or conditions that make it more reasonable or thoughtful to have those people in the community and get care in the community than rather in our prison systems. And so what was, I think, exposed to us is our current compassionate release statute is that it was too restrictive. It didn't allow for the opportunities to have those reviews. And so that's really what brought us all together. So what I'd really like to ask Senator Dembro and Representative Reynolds sort of at the outset is, why are you working on compassionate release? I know you touched upon this a little bit, but why this bill? What is motivating you, or what do you see as, from a legislative standpoint or as a legislature, as a policy matter, like why is this important to you?
Yeah, thanks for that, Bob. And I would say that what brings me to this issue is a couple of things. First of all, I would trace my interest back to a trip that I took inside OSCI back in December of 2019. It was an interaction, a discussion with several AICs and legislators that OJRC had set up. And those adults in custody had been doing research projects on several different issues. One of them, I'll say, had to do with voting rights for people who are incarcerated. And that actually has led to legislation that is going to be voted on in the Judiciary Committee in the Senate next week. But another presentation was on the subject, the problem really of the growing number of the elderly in our prisons here in Oregon. I think, Bobbin can speak better to this than I, but Oregon has a very high proportion of elderly adults in custody. It's kind of a function of our long sentences and, as well as, well, I mean, I guess that's probably it. And we talked about the problem. The adult in custody who was speaking to it talked about some national research, and we actually talked about having a work group on that subject. And so I wouldn't have been surprised if we wouldn't have had a task force this term set up on the subject of elderly adults in custody. But in the meantime, something happened, and that's COVID, right? And that sort of brought a somewhat different dimension to it because of the huge danger that COVID has posed for adults in custody in our prisons. Some of us have been working on getting early release for adults in prison, something that I and about a half dozen other legislators have been working with the governor on since last May, April, May. And I have to say it's been a very frustrating process. On the one hand, it really revealed to me how hard it is to get early release, actually to get our parole system is really dysfunctional, our parole board system. And we have people who've been waiting for, and also our clemency process, very hard to navigate. It's something that really needs a lot of reform. Having said that, the progress that we were able to make on getting some early releases have been through the lens of, the health of adults in custody, so that those most at risk, those with the most compromises health-wise, there was openness at the end of the day to providing them with early release. And so I think that is something that the public can understand. But this should be something that we, again, one of the lessons of the COVID experience has been awful, but if we don't learn important lessons from it moving forward, we'll have wasted a lot of opportunities. So that's what this bill really is about. Looking at those weaknesses that exist and trying to bring a systematic nature to repairing the problem, so that we have a standing medical advisory committee, so that there's a standing process, and we don't have to go through what all too often happens in these parole hearings, where the offense that sent the adult in custody into incarceration is just relived. The district attorneys sort of relive that crime that happened, and that becomes the story rather than the basic question of, has the person served their time? Are they a danger to society upon release? Those should be the considerations that are used. So that's, I think I've said enough, but I look forward to delving into this a little more and talking about how we can successfully pass this bill this session. Okay, I'll turn it over to the newbie.
Thank you. I don't have much to add. That was very well said, Senator Denbrough. But I think what struck me when Bob and I first met about this a while ago was just how peripatetic the whole system is and how difficult it is to successfully be granted medical release. So I love that this is a systematic approach with, starting with the medical lens, and then wending its way through the other system, and obviously a medical lens that isn't at the discretion of the Department of Correction medical providers. So I think that's really important. And then, you know, and I mean, of course, I alluded to COVID earlier, and COVID really is an important player here, if only to, like I said, open our eyes to the difficulties of the system and how difficult it is to get clemency or early release or early medical release. And just also thinking about the conditions for adults in custody. You know, obviously there wasn't any way to do the social distancing that was recommended early on. And then it was pretty disheartening to hear about how much the staff was kind of refusing to mask when we knew that most of the COVID cases coming in were brought in by the staff. So again, you know, trying to right some wrongs with how the health risks that adults in custody are exposed to. And then I do, as Senator Deborah alluded to, I do think of, I'm going to misquote you a little bit here, Bobbin, but what Bobbin said has really stuck with me is that a lot of our mental health care in Oregon are being done in prisons. Let's not now have the prisons be the source of a big chunk of our elderly care. So I think our aging prison population, you know, disproportionate among other states compared to other states, is yet another reason to really think about early medical release and putting a system in place, which I think makes such good sense. So I'm really, really proud to be part of this work, and yeah, I look forward to how we're going to get it done.
Well, thank you so much. I think, you know, it's very exciting to hear the energy and the passion and the commitment from both of you. And, you know, again, to have this type of partnership with elected officials for us, I think is, you know, what drives us and what motivates us and gives us like a lot of inspiration to be able to help, you know, to help you be successful with these things that you're interested in and seeing done in our state. So I'd ask members from OPSR, I'll ask maybe just one person, maybe Anne, if she could chime in as to maybe OPSR's perspective of like why this bill, why this concept, and yeah.
Great, well, thank you. Well, as everyone has noted, we came to all this because of COVID-19 and the obvious safety risk for prisoners, and that's played out in the death of 42 people in prisons, so that there has been really no mechanism for quickly releasing people who are at risk. And I certainly believe that the reason for this bill or this improvement on the current statute is because compassionate release is the right thing to do. It's the humane thing to do for people who are seriously and chronically ill or who are vulnerable. And I think this quote from Jennifer Black, who's a spokesperson for the Department of Corrections, she made this statement in January. Quote, as these past days illustrate, Oregon's prisons have not escaped the devastating impacts of COVID-19. More than half of the DOC's, Department of Corrections, the incarcerated population have been identified as COVID-19 vulnerable based on community standard criteria. Generally, incarcerated people are in worse health than their peers in the community, and Oregon has one of the oldest incarcerated populations in the country. So this is just to emphasize, I mean, they already know this. So I believe that, you know, as a state, we need a bill that really makes it possible for people in prison who have serious illnesses to be released. And certainly, as Representative Reynolds pointed out, we have a lot of people in prison who are suffering from mental illness and also from substance misuse disorders, but also there are just many people who are older and chronically ill. And these are people who are vulnerable to the risk of injury and victimization in prison. And prisons really are not well equipped to meet the needs of the elderly and chronically ill patients who often require intensive services for these conditions. So I think that, as you'll learn as we go through the bill, that this bill does provide a clear pathway for people in prison or their family members or the prison staff themselves to apply for compassionate release and have each person's situation evaluated by an independent medical professional group that would then make a decision in a timely fashion. And so I believe that this is an extremely important bill that I hope that will get a lot of traction and move forward now before our next pandemic, before our next public health crisis. So yes, I really appreciate Senator Dembro and Representative Reynolds' support on this important bill.
Thank you so much. That was, I feel like you captured everything and we can just stop the webinar now. It was very, very well said. And, you know, as Senator Dembro and Representative Reynolds and you have mentioned, I think you've captured sort of the essence or the spirit of what is driving the energy behind this bill. So before we dig deep into it, I think because this is part of the legislative process and the political process, you know, even for myself, this was a very foreign sort of, it was very foreign to me, like how I generally understood how bills were passed and, you know, made and the legislative body exists. But until we actually got involved organizationally more with policy, it only was then revealed to me sort of all the twists and turns a bill needs to go through in order to pass. So because we're fortunate enough to have Representative Reynolds and Senator Dembro here, what we really want to do is make sure people who are watching this understand this process and more importantly, how to engage with this process, because civic participation in the political process to me is the surest way for us to be able to effectuate positive change. If we can get more people involved into the conversation, the better. So I'll start with Senator Dembro. If you're able to just walk us through the legislative process and what it looks like, that would be great.
Great, yeah. So, you know, the first step in the process is to request that a bill be drafted. And I mean, I'll go even further back. It was, you know, Zach reached out to us about this idea. And, you know, Zach, one thing, although he's new at this, I guess, one thing he knew inherently was form a good relationship with the legislative staff, which he did. And they, you know, I want to thank Eileen Rubalcaba, who's my legislative aide, who really has been shepherding this work. You know, the first thing that you do is figure out, okay, what do we want the bill to look like? And then put in the request to have it drafted by our legislative council. And we did that both for a House bill and a Senate bill. We wanted to make sure that we had the same bill available on either side, and then we would figure out, which chamber becomes, sort of the, the primary place for it to go. If you have enough time, you might want to work it in both chambers so that you have good hearings in both chambers. I don't know if that's going to happen this time. Rep Reynolds, you can tell me about the House side when you speak. Everything is kind of strained this session, with us having to have our meetings remotely because of COVID. There are time constraints on a lot of things, and so there may not be enough time to have hearings in both chambers. We will be having a hearing here on this side, but actually I'm jumping ahead of myself. Once the bill comes out, once the draft comes out, then we look to colleagues to be sponsors of the bill. And again, in normal times, we would go in person to one another, and we'd have a sheet of paper and ask our colleague to sign on. And there would, generally be, for a bill like this, I know there would be a long list of sponsors, but because of the way the session is, we just really focus on having chief sponsors. So Rep. Reynolds and I are chief sponsors on both the Senate bill and the House bill. And I think we may have a couple of others as well. The sponsors, at least on the Senate side, once the bill is available, even though it has been first introduced, senators can still sign on as sponsors and as co-sponsors. And when we get to the to-do part of this, I think I'm going to ask you all, if you're looking for things to do, getting additional sponsors onto the bill is a good thing for you to do, to reach out to your representative or senator who may not yet be a sponsor, to get them to be a sponsor. Then the bill is, once it is introduced, it's then referred to a committee. So on the Senate side, the bill was referred to the Senate Committee on Judiciary, and on the House side, I assume it's been referred to the House Judiciary Committee. Yeah. And then you try to get a public hearing scheduled. And what's really important at this time of the session is to also get a work session scheduled. And that's where the committee actually votes on the bill, to get it out of committee and into the next step of the process. And we are actually up against our deadline tomorrow. Tomorrow by midnight, any bill that has not been calendared, or as we say, posted for a work session, is essentially dead. You can have a hearing, but it can't move forward. So it's really critical is that the bill be posted for a work session. And I'm happy to say that the Senate bill is, it's scheduled for a public hearing on March 29th and in Senate Judiciary, and then it is already scheduled to be voted on April 5th. So March 29th, when we get, now I'll defer to Rep. Reynolds next, but I think we're going to come back and talk about what you can do. And that's when we'll talk about participation in the public hearings and outreach via email or calls or whatever you can do to your representative and senator to get them to support it. So, Lisa.
Yeah. Thank you. I will say we really, I think we found out a few minutes before 3 that the House bill, which is House Bill 3298, has been scheduled for both a public hearing in House Judiciary and a work session. And so I may have to ask Senator Dembrow, what does that mean when you have kind of these parallel tracks for both these bills? So I'd be curious on that. But I will just say then, kind of to finish, I think if we just talk about it from the Senate side, so, the route to passage would be, and please correct me if I say anything wrong, Senator, the House Judiciary Committee would have a public hearing where the public can weigh in. We'll talk about how y'all can contribute to that. And then a work session where the committee would vote. You need a majority vote to then send that bill to the floor of the Senate. It gets read in front of the Senate chamber, and then the Senate chamber votes on it. And if it passes the Senate chamber, then it goes over to the House side to be voted on through committee and then the floor as well. So, and then if it passes all that, it gets signed by the governor. So I kind of sped through the rest of the process, but I am curious, Senator, on your thoughts on this parallel track. I don't think I've experienced that before.
Yeah. So there is another wrinkle here, that I'll add to what you said. That, what Rep. Reynolds said is one scenario for this, but there's another scenario that may actually be the more likely one, and that is that as the bill is prepared for debate and a vote in the committee, our legislative fiscal office will analyze it to see, will it create any cost to any of our public agencies? And I have a feeling that this one will have some cost. I don't know how much, but there will be a responsibility, I think, for the Department of Corrections to set up the medical advisory committee. Obviously, if people are released early, there's going to be savings there, but those aren't really taken into account. What's taken into account is, will there be any cost? And if there is, then when the bill leaves the committee, it will need to go to the Ways and Means Committee, which is our budget committee. It's a joint House-Senate committee, and it does its work through subcommittees. So there's a public safety subcommittee, which is probably where this bill would go. If the House and Senate were both to work these bills, the parallel bills, they would both go to Ways and Means, and there they would be combined. Or there would be a decision, we'll go with this one or we'll go with that one. I have a feeling that's the way it's going to go. But we have a couple of weeks to figure this all out.
Well, that was really instructive for me. Sorry,
how a bill becomes the law.
Did you want to add anything else? Sorry, Representative Reynolds.
I was just going to say, I forgot about that intermediate. I shouldn't call it intermediate. That kind of seems to downplay, because it's really important, the important step of the Ways and Means. And if it gets approved from a budgetary point of view as well. So, yes.
So yeah, that was also helpful for us, because we have other bills that are in that process, and we have a bill that's in both chambers as well. That was something that we were trying to understand, like what would happen with that bill. But if folks are wanting to get more information about the Oregon legislature and track bills, the website, even though it may appear a little bit overwhelming when you go to it, but OLIS, or the Oregon Legislative website, is a really great resource. And there's a lot of, I think, very easy to read information or digestible information about this process. So if you just take some time to explore it, there is some like FAQs and some 101s and things like that, and some of the things that Senator Dembro and Representative Reynolds spoke to. And once we get to that how-to and what we need you to do, or folks listening to this, we'll guide you towards OLIS as to the place where you submit testimony. So as we move forward, I think the next thing we want to do is dig into the bill. So I'm going to have Zach just kind of provide us with an overview of the mechanics of the bill and the logistics that we're creating that are distinct and different than what currently exists. And then we'll kind of quickly go through the different criteria of the compassionate release with PSR members. So I'll have Zach just kind of walk us through the mechanics. And we do have a one-pager that we can make available on our website that has like a nice flow chart on it as well. So Zach will help us understand what it is that we're trying to create here now.
Yeah, and thank you, Bob. And I think I just want to start with kind of an overarching, I know it's kind of been talked about, but an overarching view on kind of why there needs to be an overhaul. And just based on some data, which has been tough to come by, according to some testimony that was submitted in 2015 on another bill by the board chairperson for the Board of Parole, between May of 2010 and May of 2015, the board received only 3 requests for early medical release. 0 of those requests were made after 2012. So the board received no requests for early medical release for at least 2.5 years. Additionally, an article in Willamette Week in 2017, based on public records requests, only 53 AICs, so adults in custody, requested early medical release since 2011, and only 1 AIC was granted early medical release from 2011 to 2017. And Senator Dembro and Rep. Reynolds touched on COVID and the pandemic and the effects that has had. And we have some numbers from March 1st, 2020 to June 10th, 2020, where only 1 request was granted. 459 requests were pending on June 10th, 2020, and then 6 requests were denied at that point. So I think, the numbers show some concerning trends over a significant amount of time, not just the pandemic, which exacerbated the issue or maybe highlighted the issue, but it's been going on for some years of access to early medical release or compassionate release. And so now, Bob, and I'm happy to turn into the actual bill here. So I'm going to read off some of what the bill does, and I'll do a quick run through of a kind of a flow chart that you would see on the one pager. So high level overview. Both bills are identical, by the way. So if I speak about Senate Bill 835, it's exactly the same as House Bill 3298. So they expand eligibility criteria so that compassionate release is available to all AICs or adults in custody in need of such release. So there is no carved out population because there's no carved out population who's incarcerated. So it applies to everyone. It creates an independent committee of medical professionals, medical, mental health, and addiction from various disciplines who are appointed by the governor and compensated for their time to review applications and make release recommendations. And then those recommendations carry a significant amount of weight in the ultimate release decision that the full board of parole or sentencing court makes. And we can get into the nitty gritty on that in a second. But essentially, it's to say that we're trying to flip the normal course of action, which for parole or for early medical release, compassionate release, is to start with the question of, is this person a safety threat? And then, is the person medically qualified? And the goal here is to really flip that the way it should be in a compassionate release statute, which is to say, is this person medically meet the medical criteria for release? And then there should be a high bar for if there's significant public safety concerns, then they're not going to be able to be let out on compassionate release. And so we do set a bar that's relatively high for public safety, just to make sure that that the medical analysis is really put first. It also allows for decisions to be made in a timely manner and creates an expedited process. So generally speaking, it would be the normal course of action would be 45 days, a decision within 45 days of a completed application. There's also an expedited process, which would be 14 days from completion of the application. So, it's really making sure that individuals who meet these criteria could potentially have very little time and need to get out as soon as possible to receive the care they need, even potentially some hospice care. And so we want to make sure that happens without delay. It also requires agencies to get information out on the new compassionate release statute, right? So I think based on the numbers that I mentioned earlier, it's clear that either that individuals aren't getting out, but it's also clear that individuals are maybe don't know how to apply, or it's inaccessible to them because the numbers are so low for individuals requesting release. So the goal is to make sure that there's education around that of who's eligible, how do you apply, and then submitting that application. It also requires data collection and reporting. As I mentioned a little bit earlier, the numbers are really tough to come by. There needs to be more transparency as in many areas of criminal justice reform. Transparency is paramount here, and we're aiming for that. So, Bob, and if I have a minute, I can get through the flow chart. The application would be submitted to the committee, the medical advisory committee that I mentioned. The expedited process, again, is 14 days. The general process is 45 days from receipt of application. The committee then determines whether compassionate release is necessary. If it's not necessary, then the application is denied. And while no appeal is authorized in the statute, an applicant can reapply if there's been a change in their condition, or if new information has been received that would further inform the medical advisory committee. If they do determine that release is necessary, the application is forwarded to a staff attorney who's also compensated with recommendation for release. The staff attorney then assesses whether the application should proceed to the courts or through the motion or to the board. It's a lot more complicated than I can get into it in 30 seconds, but essentially they have to make a decision on which way to go based on the individual sentence and judgment. if to the board, then the committee's recommendation in favor of release can only be overturned if the board finds by clear and convincing evidence. So there's preponderance, clear and convincing, and then beyond a reasonable doubt. So it's that the middle standard there, that the applicant is a substantial threat to the public. So there's the public safety bar that needs to be met. If through a motion to the court, the judge can resentence the applicant in the interests of justice to allow for compassionate release. So that is I think I made it, or didn't make it, but there you go, Bob.
Thank you, Zach. Yeah, and I think the structural barriers that we've faced over that we've recognized is significant. And so what we're really trying to do is create a more streamlined process. And I think, as Anne mentioned, an independent process and a process that has individuals with the requisite professional backgrounds to be able to assess the medical decision. And the advisory committee would consist not only of medical professionals, doctors, but also other public health professionals, whether it's mental health, addiction, just generally public health. So that way we could have a diversity of individuals that have that background, that could assess an application and make a correct judgment. And I think those are the two things that are really missing right now, is an independent body with the requisite background that can properly assess these applications in a timely way. So that's the things. And then the other things that Zach mentioned is essentially transparency and record keeping, and just making sure that we understand how this is being used, who's using it, and ensuring that adults in custody have access to this information and staff have access to this information, and that it's clear and that everybody understands how they can take advantage or access this review if they meet the criteria. So now we'll move into what the criteria actually is. So I'll have members from Oregon's Physicians for Social Responsibility kind of walk us through, but I'll start to list them off. So the first criteria is if the applicant has a terminal illness with a prognosis of 12 months or less to live. So I'll let anybody from OPSR kind of just chime in and let us, what does this mean, and in like 30 seconds or less, and why is this important?
Well, it seems to me that this one is pretty obvious. If someone has a terminal illness, then, generally, I mean, even though it's difficult for anyone to assess how long someone has to live, but if, it's still done all the time in terms of hospice or palliative care. And so I think the criteria of a year is, makes sense in that regard. And are you going to read these, Bobbin? Because I don't have the document in front of me.
I will be reading them. Yeah.
Okay.
So that's the first one. And I think, when we think about compassionate release, I think terminal illness is often the one that we think of most sort of intuitively and most obviously as people who are facing an end-of-life situation through a medical diagnosis or a medical issue. The idea is to be able to allow that individual to have that time and in an environment with dignity and possibly with family and support and things like that. And again, prisons are not meant to really be institutions that are facilitating sort of this end-of-life treatment. The second criteria is the applicant has, and these are all disjunctive, so it's ors. The applicant has a debilitating or progressively debilitating medical condition.
Well, so again, I think the idea of a prison setting being able to actually provide adequate care for someone who may have mobility issues, may not be able to do what we call the activities of daily living, like taking a bath, or brushing your teeth, or even eating on your own. It really just doesn't make sense for those people to be in prison, and they should be in a more humane setting, hopefully with family, but if or another setting where they can get the care that they need.
The third criteria is the applicant has an underlying condition that places the adult in custody at increased risk of medical complications or death from exposure to the disease. And this one, was really sort of thought of in the COVID context in some ways, So yeah, if you could
Right.
explain that.
Well, I think that, the idea that, as Jennifer Blackman said, that half of the prison population have this vulnerability, would qualify under this index for compassionate release. And I mean, that just says a lot in itself. And I think that prisons or states where they have released a significant amount of prisoners or adults in custody have seen much less impact from death from COVID. So we don't know what the next public health crisis may be, but it's certainly, I think we can't assume that it'll never happen. This will never happen again. And we need to be prepared.
Mm-hmm. And, I'll just caveat, like, as we're talking about this bill, there are amendments that are coming out that will be posted. And we are hopeful to have constructive dialogue with the Department of Correction and Board of Paroles around these, because the goal really is to ensure that these criteria is getting at the population that we're really thinking about. And so that's really, these are criteria that we've developed, but we really believe this is an appropriate criteria to be able to look at. But it's not to say that there may not be some back and forth conversations in the future as well about all of this. And, some of this may change. And if folks who are listening do have any ideas or thoughts or constructive thinking around this, we welcome that as well. The next criteria is the applicant is physically handicapped or permanently incapacitated to such a degree as to be unable to move from place to place without assistance or unable to complete basic activities of daily living.
Right. Well, I think I really discussed that in the previous bullet point, but I think it's hard to imagine that there are enough prison staff available to assist people in their activities of daily living if they are so incapacitated. And it's just, it's not a humane way for people to spend the rest of their life.
Yeah, and I think like one of the more profound sort of things that I see when I go into the prison is when I will walk by, especially during lunchtime or one of the meal times, you'll see some of the elderly prisoners or individuals that have some physical mobility issues. And there's like a line of walkers, sort of outside the chow hall or units and things like that. And, I think it hits you much stronger when you see it in that environment. The next criteria is the applicant has been diagnosed with a mental, behavioral, or emotional disorder resulting in serious functional impairment that substantially limits one or more major life activities or personal safety.
Right. So I think that, as the people with serious mental illnesses who, may ultimately not be able to function in a way that is in their best interests, or, it may put them at safety risk within the prison setting. It seems that this particular setting would not be a compassionate way of treating people with serious mental illnesses who can't be controlled with medication.
The next criteria is the applicant has significant limitations in adaptive behavior, including but not limited to conceptual, social, and practical skills in everyday life.
So I think this really speaks to people, particularly older people who may have cognitive impairment. And I think that significant cognitive impairment is going to really affect their ability to simply survive in this setting of incarceration. And I think that there's very little safety risk with folks who have significant cognitive impairments. Safety to the public. There may be, I think the safety risk is really to themselves in the prison setting.
So that's the new criteria that we've established in this bill. And I just want to give an opportunity for other members from OPSR to have any quick thoughts or remarks on them, and Senator Dembro and Representative Reynolds to maybe follow up, since we're just at the hour mark, with that last thing of what can people do to support this effort, and any thoughts on the criteria as well. So I'll leave it open to the OPSR members, and then after they've done, I'll invite Representative Reynolds and Senator Dembro to wrap us up.
Well, I just wanted to quickly share the OLIS site, which I just had pulled up, but of course now. But also just the criteria and maybe some personal insight that I've had with loved ones that are incarcerated. For one, I've definitely experienced kind of manageable mental health issues being exacerbated by incarceration, and folks, serving the time that they've been sentenced to and coming home really kind of broken. The experience does nothing positive for anybody suffering from any mental health issues. And then if you add mobility and medical health issues, it becomes a real problem. And from folks that testimony I've heard from incarcerated folks, it's not only hurtful for those experiencing the mental illness and the physical limitations, but it's painful for everybody. It is painful for the whole population to see somebody, when somebody can't control what is happening, or they can't follow certain guidelines, but they are being punished, and the situation just exacerbates and gets worse. So I just kind of wanted to share that, and also a quick insight too on why it's so important to do this work now and be prepared. I had loved ones that were incarcerated during Hurricane Katrina, and that was devastating. Prisoners were left to die without food and water for a week, and with waters 9 and 12 feet, surrounded in buildings of waters that deep. Many prisoners couldn't swim. So there's always I feel like there's always gonna be that, the fires, there's always gonna be a need in that aspect, in that emergency preparedness, but also just thank you everyone for being so compassionate and bringing a human lens to this issue, because that I think that's the heart of it, why we need to address these things. So I will go ahead and share the OLIS website for the Senate bill, so folks know when they get there, what it looks like. And we also shared this link in the chat, and it's on our various other places. But here you'll see the chief sponsors and everything like that. Yeah, and just sharing that. Thank you.
Robin, can I jump in and say two things?
Yes, please.
Yeah, Yuvia, if you could put that back up, that website, because I do want to point out one thing, and that's that at the top of the screen, you see that follow this bill, e-subscribe email. I would encourage you to click on that, and then you will get automatically any of the information related to this bill, when it's scheduled for a hearing, what the status is, et cetera. And you can also, if you'd like, e-subscribe to everything coming from the judiciary committees, if you're so interested. So that's one thing I would point out. I just want to say, I just noticed that our colleague Senator Gorsuch is also a chief sponsor. And the good news there is that he chairs the Ways and Means Subcommittee on Public Safety. So if this does have to go to Ways and Means, he'll be well positioned to help us. Bobbin, do you want me to say just something about testimony?
Yeah. Since we're, I think, a little bit over the hour mark, I think it's best that we, try to wrap up. But I just want to say I didn't know about that e-subscribe thing, so that's great to learn.
Great. Yeah. As was mentioned, we have public hearings scheduled for both these bills, and we'll want to have, if we're going to have testimony on both of them, that's the good thing about having parallel testimony, because we don't necessarily have to have the same person or persons speaking to each one. We can kind of spread the love, spread the wealth. And I assume that Zach, you and OJRC will coordinate that with our staff. That's really the best thing. I don't know how much time will be available. It'll probably be hard to have more than a half dozen people testify in person. So you want to be really careful about, getting the best people, those who can sort of give value added to the written information, who maybe have personal stories to tell, who can give a kind of unique perspective. Because that is what moves legislators, I have to say, is the personal stories, the human dimension that can really make a difference. Everyone is free to submit written testimony, and that is a great thing to do. You can do that directly on the website, and you can do it anytime. Well, I'm not sure. You can do it in advance of the hearing, and then up to 24 hours after the hearing, you can still submit your testimony, and that becomes part of the public record, and people will read it, and it can be influential. So that's one thing you can do. And then also, as I mentioned before, reaching out to your legislators on this issue. If it goes to the Ways and Means Subcommittee, you'll certainly want to communicate with the co-chairs of that committee. And, I think it doesn't hurt to reach out to everyone on the committee, as well as your own representative and senator. And again, the more you can kind of personalize it, the better. We get a zillion form emails, and I'll read the first one or two, but once I see that it's essentially the same thing, I'm not going to, sorry, true confessions. I'm not going to reread it every time. So the more you can make it your own, give it your own subject heading that is, something that's more personal for you, really the more effective it'll be. I would say under normal circumstances, come to Salem and, come and hang out, make your presence known, but here you would have to stay outside the building, at least for the next month. So Rep Reynolds, anything you want to add?
No, that sounds great. I totally agree. Personal stories are really powerful. Personal emails, yes, I've gotten, and I've signed some of those form emails. I don't know if I ever will again. They really, we do tally them, but especially as I think healthcare providers, you have a lot to add to the story. Obviously, Yuvia, your story is really powerful. And I'm happy to stay on for a minute or two if you want me to show you how to sign up or to submit testimony. And that's just going back to that website if people need that information.
If
Yeah.
you could, that would be great. I actually have a 4 o'clock meeting.
Yeah.
I should be going.
I have a staff meeting at 4. They know. So, but yes, I'm happy to do that. And I think it makes it just, I'd love to demystify the process. It's actually pretty straightforward.
That's great.
Yeah, if you want to bring up the website again, then we can have Representative Reynolds walk us through that, and then we can wrap up.
Okay, so I'm going to jet, Bobbin.
Thank you very much, Senator
Report.
Deborah.
Yeah.
Really my pleasure.
You know, Senator Dembro has become like a folk hero with his daily COVID. I love it. I mean, so Senator Dembro has been writing daily COVID updates since over a year ago. And early on, he was the best source of information. He still is a very good source of information. So I was just a candidate. I wrote him, I'm like, you're brilliant. Like, he had better information than the Oregon Health Authority. And so he's been featured in Willamette Week and in Portland Monthly. But anyway, it's really an amazing service. So, okay. So if you can, subscribe to the email, I think makes sense. So if you could scroll down, Yuvia, to where it says so measure history, if you can click on that. So public hearing scheduled. So if you could click on that. And then this essentially takes you to what is the agenda for the day that there will be a public hearing on this bill. So I think the best thing to do here, I'm trying to click, I know I can't, is if you could click on, go back up towards the top, click on the what almost looks like the date and time, the 3/29/21, 8 a.m. You can do that on the side. Thank you. Yes, or you can do it up at the top. And so, so here we are. It's as if we're looking at the agenda for that day. So, and then, and it even says instructions on how to submit written testimony and to register for Testify appear at the bottom of this agenda. So you scroll down, you make sure you're in the right place because there's our bill, right? I already forgot the bill number. What is it? Oh, 835. So you see it there, Senate Bill 835. And then, so submit written testimony, you can just click on this link. See that, right? Yeah. So if you click on this link, I always think this could be like 10 times better. I always say, do you have a user experience person, running your thing? So here, so this takes you to the page, but you have to then select the meeting date. Like, I don't think you should have to do that, but you do. So you're in the right committee, and then you have to select the 3/29, 8 a.m. And then here, then you scroll down, and here you click on the bill that you want to focus on, which is the 835, Senate Bill 835. You have to fill out your name, your email address, your city. And I will tell you, every committee asks slightly different things. It's very interesting. When I registered in health, they asked for my county or something like that. And then whether you support the bill, oppose the bill, or neutral. And this is for written testimony. And then you can upload a PDF, or you can, if you hit text testimony, you can literally just type it into a box, or you can cut and paste from a different document, and then at the bottom you submit. So that's and you have to say you're not a robot. Someone once said, what if this is like discriminating against the robots? But anyway, okay. And then if we could, so that's pretty straightforward. You could also, if you want to upload a PDF, it's pretty easy. I've done that too. And then if you want to register for oral testimony, where you will be kind of in the Zoom room during the public hearing, and they will call on you and you will speak, and they usually give you a 2-minute warning. So we're going to have to go back to those previous pages, Yuvia, or maybe start from, yeah, perfect. Okay, register to testify live remotely. So there you click here, And here it's a totally different form. You fill out your names and address, you fill out whatever they ask of you. Oh, sorry, no, we're not doing written, sorry. So here, if you see there's fields, how you want to be addressed so that the committee chair knows how to address you. So you're filling all this out. And then down here, they're going to list all the bills that are being heard in that session. So you have to make sure you have the bill number written down. It's 835. And then you would want to say, speak for it. And then submit your request. And then you will receive a link that lets you kind of enter it's not a Zoom room, it's Microsoft Teams. And then I will tell you that each bill on the agenda has well, you know what, the Senate doesn't do this, sorry. In the House, they have a time associated with it. Like it'll say, even though let's say the committee starts meeting at 1:15 p.m., each bill might be assigned a different time, but on the Senate side, it's not listed. So you basically have to you should show up close to the start of the committee meeting time, but you may have to wait quite a bit before our bill is called up and before you're called to testify. So you don't have to drive to Salem, but you do have to kind of sit around and wait until it's your turn. Was that helpful? I hope.
That was extremely helpful. I think, the more we can demystify and allow people, to understand how to access this, because it can be, overwhelming or intimidating to sort of enter this website and kind of navigate it. You don't want to sign up for the wrong bill number, or, you may make a mistake. At least in my experience, the Oregon legislature and the staff is very forgiving. And so, very friendly people and very sort of supportive of trying to make sure people are able to do the things that they need to, whether it's submit testimony or present. And so, don't be too scared if you make a mistake. No big deal. It'll get corrected. But that was very, very helpful. So we really appreciate that.
Yeah, and I do kind of have a cheat sheet that I've done for other bills when we've invited outside testimony, and we'll make one for both public hearings too.
So
it walks you through the process like I just did.
Yeah, that would be great. And when we get it, we'll be sure to share it as well.
Yeah.
we're just going to wrap up. I just want to thank everyone for listening, watching, whatever however you took this in. And also want to thank again, Oregon PSR for their partnership and collaboration in this process over the past many months, and encourage you to explore their website and their efforts and all the work that they're doing. And also for our organization, you can find us at our website and the work that we're doing. And especially want to thank Representative Reynolds and Senator Dembro for taking the time to be here. It's a very busy time, and being very generous by giving us this hour plus, I think speaks to their commitment and sort of desires and passion around this work as well. So we're very excited to be collaborating with them, and to their staff, who I think Zach has mentioned, has just done incredible work in collaborating and making sure that we could get this bill introduced and set up for a hearing. So just really appreciative of all their work. So, our goal is really to put compassion into compassionate release. Right. We think that's missing right now. And that's the goal. And, if we can put a little bit of compassion into everything else too, that'll also be a fascinating and wonderful thing as well. So hope everyone has a wonderful and an inspired day, and look forward to your support on this effort. Thank you.
And
All.
one more last,
you.
yeah, we have a couple more shout outs. Go ahead.
Thank
I'm
you.
going to shout out my staff, Maida, who I think gets credit for us getting a hearing on the House side. So thank you.
And yeah, wanted a big thank you to Oregon Justice Resource Center and our Senator Denbrough and Representative Reynolds, not only for your time and work on this, but also for your humility and walking us through the process. I think that for me anyways, it somehow hit me differently, walking it through with you all, realizing that you're in the building every day. And maybe just as confused as we are sometimes. So I really, or demystify, or like Senator Denbrough did a really excellent job of simplifying the process, and yeah, the two paths of the Senate and the House and how that all works. And so I really wanted to recognize that and thank everybody.
Yes, thank you all.
Yeah, and thank you, PSR members, so much.
Thank you.
Thank you.
Good night, everyone.
Bye.
Bye.